Towards the end of the 19th century, Pinard, a French obstetrician, first introduced a method of abdominal palpation to estimate the relative size of the fetal head and the maternal pelvis. His method was later further improved by other stalwarts like Leopold, Muller, Munro, and Purandare. Head fitting tests are done to detect contracted inlet if the head is not engaged in the last 2 to 4 weeks in a priming avida. Of the more than 100 tests described, the best method is Muller and Kerr's test. I am going to describe it in detail. Patient is placed in dorsal position with thighs flexed and separated. The head is grasped by the left hand. Index and middle fingers of the right hand are inserted into the vagina up to the level of the ischial spines, and the thumb of the same hand is placed above the symphysis pubis to note the degree of overlap. With the other hand, the head is pushed downwards and backwards. If the head can be pushed down up to the level of the ischial spines and there is no overlapping of the parietal bone over the symphysis pubis, there is no cephalopelvic disproportion. If the head can be pushed down a little but not up to the level of the ischial spines and there is a slight overlap of the parietal bones at the pubic symphysis, it indicates mild or moderate disproportion. If the head cannot be pushed down at all and instead the parietal bone overhangs the symphysis pubis, displacing the thumb, the diagnosis is severe disproportion. Following grades of contracted pelvis can be recognized during a head fitting test. Grade 0, the head can be pushed down into the pelvis without overlapping of parietal bone on the symphysis pubis. There is no disproportion. Grade 1, head can be pushed into the cavity somewhat, but the anterior surface of the head is in line with the inner border of pubic symphysis. This is mild or borderline CPD. If the head overrides the inner border of the pubic symphysis but not up to the outer border of the pubic symphysis, then the diagnosis is moderate CPD. When the head overrides the outer border of the pubic symphysis, it indicates severely contracted pelvis. This test has its limitations. Sometimes the degree of disproportion is difficult to detect because of deflexed head, thick anti-abdominal wall, irritable uterus, or a very high floating head. Head fitting test reminds me of a wonderful quote by Munro, author of Operative Obstetrics. He said, "A well-engaged head almost rules out contracted pelvis in a priming avida, as outlet contraction per se is very rare."